Pressure's normal. You must be getting excited.
Over the moon.
How many weeks?
31.
And tell me about your symptoms.
We spent the weekend at a friend's cottage up north. I started to feel nauseous on the car ride back.
And this was yesterday?
I thought it was car sickness, but this morning I had a fever.
And then we started to worry that the baby wasn't moving as much, but we couldn't be sure, so.
Let's take a look. Sorry, I know it's a little cold.
That sounds good, right?
Yes, very good. Do you know the gender of the baby? Because I think I can tell.
No spoilers.
Sorry, we've just waited this long and we want to go the distance. So.
I completely understand. Well, everything seems normal. Baby seems healthy. Blood pressure is good, so you can sit up. But there is one more thing I should look at. How long have you had that rash on your arm?
I scraped myself on the dock at the cottage, climbing down to the water to go for a swim.
Any pain?
A bit, but I bruise easily. That's all it is, right?
We just need to make sure. I need to make an incision, prep the lidocaine.
Are you worried about something?
If there is an infection, we just need to know how to manage it.
It's okay. Hi.
Hello.
Do you feel anything?
No.
You might want to look away.
Oh, he's a squeamish one.
I have other skills. Okay.
Dr. Bishop?
Yeah, what is it?
I've got a 36-year-old woman, 31 weeks pregnant, presenting with flesh-eating bacteria.
I've never seen necrotizing fasciitis in a pregnant woman.
No, neither have I. Have you treated this infection before?
No, sir, but I have seen numerous cases of gangrene.
And then you know we had to move fast.
You've started her on antibiotics.
600 milligrams of IV Clinda, 2 grams of IV Ansef. She's already on fluids.
How'd she contract it?
She scraped herself on a dock.
And the baby?
Fetal heart rate's normal.
Sepsis from infection can cause stillbirth or miscarriage.
Well, it's presenting on her upper arm just above the elbow, so hopefully we can control it and limit spread.
We'll do an MRI, see if that's the case.
And then what, Dr. Hamed? Assuming it hasn't spread, what are her options?
Radical debridement.
But that means putting her under. Extremely risky for a pregnant woman.
The only other option is amputation, and she'll need a general anesthetic either way.
Well, the decision has to be the patient's, ultimately.
I'll reach out to infectious diseases, start a dialogue with a surgeon.
I'll talk to Maria.
Are you talking about cutting off my arm?
If you choose this option, yes.
And this other option, debridement, it means I get to keep it.
Yes, but you have to understand, amputation increases the likelihood that we get everything. Debridement means cutting out only the infected tissue, but the risks of the bacteria spreading are higher.
I should have never gone for that swim.
You don't say
No,
that.
Javier, you can't. The infection is dangerous and aggressive.
Am I not already exposed?
Let's hope not, and we cannot take that chance.
And these antibiotics, are you sure they won't harm our baby?
Your baby is safe for now. The best predictor of the baby doing well is you doing well.
Which means we need to decide.
How is this happening now? We've tried for so long for this baby. That's all we've thought about for years.
A surgeon is coming to talk to you shortly, but any delay will put your life and your baby's life in danger.
This is crazy. We need time.
Debridement. I want the debridement.
No, Maria.
I want to hold our child in my arms. Rock my baby to sleep.
Radiology sent the results directly to me. The debridement didn't stop the bacteria from spreading. There's infected tissue deeper in the shoulder.
Which means amputation is no longer an option.
We need to get her back in for another debridement immediately, or she'll go into septic shock. They knew the risks. All we can do now is deal with what's in front of us.
Sir, the baby might not withstand a second debridement.
And if the infection spreads to the uterus, fetus, then miscarriage and stillbirth are very real possibilities. We need to move fast, and we are out of conservative options, which leaves us with...
A C-section. Get the baby out safely and then right into another debridement.
She's 31 weeks.
Yes, viable.
Maybe not for the mother. Delaying the debridement for a cesarean poses a major risk. Her inflammatory response could trigger multiple organ failure.
If we don't deliver, the baby won't make it.
Save the baby or save the mother?
Save both, but they need to pick who goes first. I'll call OB.
No, we can't send her upstairs. It's protocol not to let an infection like neck fascia anywhere near that ward. I'll arrange for an OR.
No.
Javier,
No, he's asking us to choose between your life and the baby's. We can't do that. I can't do that.
Not choose, Javier. Just prioritize.
save the baby.
Maria, but wait. Listen,
Save the baby.
Maria, let's talk about this. Okay?
I can't lose this baby, Javier. I won't. You know what this means to me.
Okay, Maria, but you could die.
I love this baby. It's already a part of me, and I need to protect it. I need you to be strong and there for our baby, either way. And I need to hear you say it. I need you to promise me.
Of course. Of course I will. I promise.
I love you.
There's not much time. Come on, let's go.
I'll start begging. Get the monitors up. Chest is moving. Turn the O2 to 100.
What? Wait. What's wrong? What's happening?
The baby's premature. There's added steps to be taken.
But heart rate's at 47. Prepare to intubate.
What, the baby's not breathing?
The heart rate's too low. They're working to bring it up.
Starting compressions.
Oh my God.
Pause compressions. We're good. Let's get the baby to NICU.
Heart rate stable.
What about the alarms? What's he looking at? What's happening to Maria?
She's in respiratory distress and septic shock. But Javier, I promise you, our surgeons will do whatever they can for her. Go to NICU. Your baby's not out of the woods yet. There could be choices to be made.
But Maria.
There's nothing you can do for Maria right now. I know you want to be in two places at once, but you can't. I'll stay with Maria, and as soon as there's news of any kind, I'll come get you. Go see your baby, Javier.
Maria?
She's going to be okay. It's a beautiful baby.
Margot, because of your pregnancy, you chose not to have chemotherapy or radiation, which would have shrunk or controlled your lymphoma. It has grown over time, and the blue mass you see here is the tumor, and as it grows, it becomes more difficult to address surgically, but we feel we can do so.
You're saying you can operate? They told us it was too late.
Well, what about the baby?
Show them.
Can you lift your shirt up, please? At 20 weeks, the fetus is less than a pound. Its lungs and heart aren't able to sustain itself outside of the womb, and most likely won't be able to for 2 weeks.
Well, we made it very clear when we sent in our application for a transfer, abortion's not an option.
I understand, but if we wait until the fetus is viable, it will be too late.
For our baby?
For both of you.
Mr. Bell, they told us that Margot couldn't get pregnant. This child's a miracle.
Margot, At the rate your cancer is growing, we don't have weeks to act. We have days.
Then we will pray. We'll pray for weeks.
We'll find a way. I didn't build this hospital to deliver bad news, so we will find a way to save both you and your baby. We have a lot of work to do. Okay, let's drill down on Margot Beyer. I want to hear everything we know about delivering a fetus at 20 weeks.
We've got the aliens customizing an ingestible to get the most accurate read possible of the fetus's lung and heart development.
I like that. Let's see it bigger.
It's a tiny supercomputer. The patient takes it orally, like any other pill, and it travels into her intestines, which just happens to be the perfect vantage point to see the womb.
What if it doesn't land exactly where you want it to?
I had our tech team modify it with magnetic sensors. It'll be the first ingestible in the world with motion control.
We'll be able to measure the lung and heart capacity of the fetus more precisely than ever before, and can predict down to the hour when it'll be able to survive outside its embryonic environment.
Excellent work. Annabelle, so now we know down to the hour when the fetus can survive. The question becomes, how do we keep Margot Beyer alive long enough to get there?
I'm sorry, but can I just say something?
And here comes the reality police.
Tumor mass is filling the pericardial space and causing tamponade. Her blood pressure is dropping. She is getting weaker. The sicker she gets, the lower her chances of surviving surgery. We have to play hardball. Tell them we operate or they go home with comfort care.
Thank you. I don't need anybody telling me no right now. I need ideas. Good ideas, okay? I want everyone on this. We need to buy 2 weeks for that baby. I will not accept that there isn't a way to bend time here.
So I just swallow this?
It's like an aspirin. Simple.
Now, can we all pray first?
Oh, sure.
Lord, please help this. What is it called?
Fetal monitoring ingestible.
Fetal monitoring ingestible. Guide this team of Bunker Hill doctors and help bring Angela into the world. Please,
5 liters, O2, non-rebreather. Lorazepam, 4 milligrams right now.
No, that can affect the baby. You're not gonna put anything in my wife's body that can affect the baby.
We're trying to save your wife's life. Doing nothing's not an option.
No, you're not giving her drugs. Damn it, will not allow you.
Take him out of here.
She's moving too much to inject her.
Got this, hold her head. Keep him away from her. Doctor's orders. Margot. Margot.
Am I okay?
Yes,
Is my baby okay?
she's fine.
Where's Paul?
I asked them to keep him away for a while.
What? Why?
Margot, you have a medical history that strongly suggests domestic abuse.
I don't know what you're talking about.
I don't know if that's what is happening, but I want you to know that no one should ever have to live like that. And now there are 2 of you.
I love Paul. He loves me. He does. He doesn't mean it. He always feels so bad after. He does love me. He really does.
Margot, we're gonna get you medicine to help you feel better.
Am I gonna die?
Margot, you need to listen to me. Okay? The reason you're having trouble breathing is your tumor's now choking your heart. We need to operate. Now.
What about my baby?
Your baby can't survive on her own yet. Margaret, this is your decision. I'll do whatever you want. But we've run out of time.
Doctor, someday I hope that I can forget everything about my husband. Everything he ever did to me. But this is still my child. Right now, I feel like she's my reason. She's my reason for being alive. So I'm asking you, how long can I wait before we have to do this surgery?
I have a team set and ready to go first thing in the morning.
What if we waited 24 hours? Could my girl survive?
Possibly.
Then I want to wait. Please.
Okay. At 146 days, baby girl Angela's the second youngest birth on record. And Margot Byers' tumor's been removed and she's stabilized.
Congratulations.
You did it.
Congratulations.
Thank you. Margot's in recovery. She's groggy, but still conscious. Do you want to go give her the good news? There's no feeling like it in the world.
This is yours. You do it.
Fournette. I'm Dr. Bloom. So, how far along are you?
Wow. So I can't just be big. We fat shaming at the gate?
No. Sorry. I just assumed that you were another pregnancy transfer from Southwest.
Well, your assumption is all the way wrong. I'm here for this. This trick at the shelter is trying to snatch my bags. I have to tighten that ass up.
Yeah, well, you're gonna need stitches. I think we should send you for an x-ray just to be sure we're not missing anything. Thanks. Huh. Well, it turns out I was right. Your blood test says that you are in fact pregnant.
Your test is as wrong as you are. I'm a virgin.
Are you the site consult?
I am, yeah, I'm Dr. Frome. How's she doing?
Dallas Fournette, 8 centimeters dilated, in active labor, and still angrily denying she's pregnant.
Okay, yeah, that's cryptic pregnancy. Means her mind is having a hard time accepting she's carrying a child.
Well, whatever it is, the chief signed off. We're going to get a court order to perform a C-section, if that is required.
No, hold on. Dr. Goldman, hang on. Just taking unilateral action could be further traumatizing. So maybe before we get the courts involved, you and I can assess what triggered this.
With what time? That baby is coming out one way or another, whether she wants to believe it or not.
Okay, what I'm saying is that you and I need to proceed with care.
Care? Dr. Frome, that woman never received any prenatal care, none. Other than the ultrasound I just performed, we know literally nothing about the health of this child.
Okay, I recognize that you are trying to advocate for the health of that baby, but I am down here to advocate for the health of that mother.
Dr. Frome.
Which means that we do not just strip her of her rights with a court order before I even speak to her.
Well, she's going to have to participate in her own care.
Okay.
Look, you are more than welcome to try to get through to her, but I'm getting that court order. So you have until I get back.
You're doing so great. Deep breaths.
Get off of me!
I'm
trying to help you.
Calm down.
Dallas, what are these people doing? Stop that right now.
Dr. Frome,
What is this OB doing in here? You are not pregnant.
Have you lost your mind?
This is my colleague, Safia Lazar. We have received new information. You are not pregnant. You were right all along. What we have is a GI blockage, and we need to resolve it immediately, okay? Dr. Goldman, you know Safia can handle it. She's excellent. So, here we go.
Dr. Fromm, a word?
Okay, I'll be back. Hands off, please.
What the hell are you doing?
I am getting her to participate, right? You need to follow my lead. Safia is an amazing midwife. If we need you for anything, you will know. This is for you, Dallas, and the baby. Okay, thank you.
Hey, sis. I'm Safia. You look like you might be a bit uncomfortable, yeah? Let's fix that. What feels better?
If I can stand up.
Okay, then let's do that.
Yeah? Okay, let's get you standing up now. Why don't you put your arms around my neck?
Okay.
There you go. Lean on me. I got you. Okay, I got you. It's okay, you're good. I got you, okay? Just like this, okay? I got you.
That blockage wants to make its way out, huh?
Yeah.
We need to help it, okay?
Okay.
That wave of pain is helping you move it out, so use it. And when you feel it, push like you're pooping.
Pooping?
It's the only way to get it out.
That's okay. Piece of cake. Piece of cake. Push. Good. Big push. Push it out.
Come on, bear down.
What did you do?
Dallas, I'm very sorry that I betrayed you.
People stay doing their own thing. You think you're special?
No, I don't. But I try to not manipulate people. Take away their control. Talk to me about the last time you felt like you were in control. He told me that was about a year ago for you, right? So that was right around the beginning of the pandemic. What happened then? It's okay to talk about. And whatever you tell me, whatever you choose to tell me is in your control. I'm just here to listen.
You know how all of a sudden they were screaming shelter in place, the city's on lockdown?
Yeah.
My mom was tripping. So my dad's stepbrother said I could stay with him. And I was like, bet, you know. It was cool, you know. Free food, Wi-Fi. But then he lost his job. That stimulus check went real quick. It got hectic and he got so angry. Talking about what he was owed. How I owe him. One night he just started taking. And I told him, I don't do that. I never have done that. But he didn't care. He would just take and take and take. I got tired of fighting, so I would pretend I was somewhere else. That wasn't me or my problem. Couldn't be. So it wasn't. That was her. And I'm still Dallas.
You repressed a trauma for your own emotional safety. That's what you did. But you know that you were more than that trauma, right? You know that it may be a part of you, yeah, but you are so much more. You will be so much more than that trauma.
Until something else happens.
There's always going to be something that we can't control. Always. But there is one thing that you can control. what you do next.
Hi, Ella. I'm Dr. Sharp, one of VJ's colleagues.
Of course, double French roast, splash of agave. I'm sorry, I'm not standing. I'm worried that if I get out of this chair, VJ's gonna die during surgery. I have OCD, and my irrational thoughts won this round.
It happens.
I wish it hadn't, because sitting is making my leg cramps worse. I stretch, but they just keep coming back.
How long's that been going on?
An hour or two. I woke up breathing better for the first time in months, but my back gets hot, and now this. And I don't know, my pregnancy podcast said I was gonna start feeling confident and sexy.
Ella, it sounds like you're in labor.
Contractions are organized and 4 minutes apart. It's official.
What's official?
Ella, you're gonna have a baby today.
Oh, no, that's impossible, because my due date's in 3 weeks. On a Friday, and today's Tuesday. And Dr. Richardson was gonna deliver my baby?
Looks like someone wants to crash this party early. I'll be covering for Dr. Richardson all day, so I think we'll be seeing a lot of each other. I'll be back in a bit to check on your progress.
Thank you.
This is not OCD. This is a relaxation exercise.
Good. No, good. Relaxing is good.
How is this happening? I am not ready for this.
Is there someone that you would like me to call? Family? Friends?
No, there's only VJ. And he promised he'd be here for this. Okay. You could try my doula, but I think she's in Portland this weekend for her great-aunt's birthday, so that feels like a dead end.
I know a great doula here at New Amsterdam.
She's been working with me for the last 26 weeks on ways to manage my OCD for this specific moment.
No.
I had a plan. I had such a perfect plan. Oh.
Leila, hi. Can you clear my afternoon, please? No pages, no patients, nothing.
What are you doing?
I'm kicking off your new plan.
You're fully effaced and dilated, but the baby's still at -3 position. Ella, the delivery isn't progressing as I'd hoped.
What does that mean?
When your next contraction comes, you need to push real hard.
Oh my God, this is a disaster.
Maybe you could hold her hand.
Ella, count them out with me, okay?
Whoa! Here we go. Give me the biggest push you've got.
You can do this. Come on, come on.
Yes, I can't. I stop. I don't want to. What if the baby's not okay? What if I hurt it? What if I ate undercooked meat and didn't know it? And 7 weeks ago, I took a bath right after the tub was cleaned, and the water probably had bleach in it. What kind of mom is that careless?
You are not careless. You have a disorder that sends your pregnancy into overdrive, but you fought it, and you've made it this far.
I cheated. I got scans all the time. Sometimes 2 days in a row in case something happened while I was sleeping. But then everything shut down and VJ got sick, and I don't know why, but I just convinced myself that the baby was gonna be okay as long as he was okay. What if VJ's not okay?
Ella, everything on that monitor says that your baby is going to be okay, but you have to deliver it.
No! Oh!
Contractions peaking.
Yeah! You can do it. Your baby needs you to push now. You've got this.